Today we will be learning competency 4.11, and it says discuss in brief applied physiology of GIT. Means applied physiology here means we have to study different disorders of the gastrointestinal system. The first one is peptic ulcer. We have already conducted one class on this, and it has been taken by Dr. Swapan Shaka. We have one EC program, probably tomorrow. So in that class, I will also discuss about peptic ulcer. So in today's class, we will be covering Gastroesophageal Reflux Disease, GERD, vomiting, diarrhea, constipation, Adynamic Ileus, and Hirschsprung disease. So these are the topics today we will be learning. And starting with Gastroesophageal Reflux Disease, in short we call it GERD, GERD. It is a chronic disease of the GI tract in which stomach content persistently and regularly flows up to esophagus. It may come up to mouth also, in the mouth cavity. In this condition, what happens? There is reflux of stomach content or intestinal content, and the stomach contents are acidic. So acidic contents are refluxed, regurgitated into the esophagus. As these are very acidic in nature, this food, bolus is acidic, and it will create some symptoms and complications. This symptom is, the most important symptom is heartburn. Heartburn. So when there is, you might have experienced this heartburn. So when esophagus is repeatedly exposed to acidic reflux material for prolonged period of inflammation, prolonged period of time, inflammation of the esophagus may occur. So every time these acidic contents are coming into esophagus, so there may be irritation of the inner lining of the mucosa, that is called esophagitis. Okay, and in severe cases, when it is persisted, this sort of incidence frequently happens, then what will happen? There will be erosion. There will be ulceration in the esophagus. Heartburn is the most frequent complaints by GERD patients. This is the most important complaints made by the patients. So see what happens. There is a sphincter here. This is stomach and this is esophagus, and it is the diaphragm. So there is a hole in the diaphragm. Through this hole, actually esophagus passes. So at this junction, there is a sphincter, lower esophageal sphincter. Mainly, the cause of GERD is malfunctioning of this sphincter. Malfunctioning of the lowering of pressure. The sphincter should be, when food enters into the stomach, the sphincter should create pressure through muscle contraction. It should close, otherwise there will be backflow of contents. So if the sphincter becomes loose, pressure is reduced, then what will be there? Stomach is contracting for digestion. So as a result, and at the other end, the duodenal sphincter at that part, it is closed during this process, peristalsis in the stomach. So contents of the stomach will be refluxed into the esophagus. So it is mainly due to what? Malfunctioning of lower esophageal sphincter. So it is actually allowing, see, it is normal, this is sphincter is closed. So it is, what is happening? So food is circulating within the cavity, okay, by GI tract, by movement of the stomach. But if it is loose, pressure is reduced here in the sphincter, then when stomach is contracted, the fluid or the mass content will be entering into the esophagus. It may come into the throat, it may come into mouth also. And it occurs in every adults. It may adults particularly above 40 years of age, and about 10 to 20% of adults has experienced GERD. Increased incidence is seen in pregnant women, and it can occur in infants. Okay, so these are the epidemiology. And what are the risk factors? What causes GERD? So we can say obesity is one of the important factors. Alcohol use, stress, hurry, worry, and curry. What is this? Hurry, worry. There are some person, they are always in a hurry. While eating, there is also hurry. And worry. They remain always worried. Okay. And curry. They like to eat curry. Means having spicy foods. So all these things, hurry, worry, and curry, these are also one of the important cause of peptic ulcer. Okay. And all these three are actually lifestyle, because of lifestyle. So these GERD and peptic ulcer, these are lifestyle disorder only. Okay. And smoking, cigarette smoking, it may cause GERD. Excessive caffeine, tea intake, these may cause spicy food, fatty meals, rapid eating behavior, irregular meal, respiratory diseases, hiatal hernia. I will come into this. Hiatal hernia, vomiting, pregnancy, scleroderma, and certain medicines like beta blockers, dopamine, sedative, anxiety, bronchial, and painkillers, NSAIDs. We know that. If we take these NSAIDs and drugs, it may cause acidity. Symptoms. What are the symptoms? Heartburn. One is important is it is also called pyrosis. So you remember this. Heartburn, the medical term is pyrosis. Okay, and a sour taste because of acidity. So this is coming up to this is when it comes into the mouth, then it will provide you sour taste. And regurgitation means when stomach contents back up to the mouth. So when the contents up to esophagus, okay, but when the contents come up to the mouth, then we will call it regurgitation of the contents of the stomach. And there may be nausea. Initially there will be nausea, then only GERD symptoms will appear. And burping means belching, excess wind in the stomach, that this is belching. Okay. And bloating means distension of stomach. So because of formation of gas in the stomach. So these are the symptoms of GERD. And other symptoms are there may be dry cough and throat cleaning. So this throat cleaning repeatedly, sore throat because of acidity. So the throat may become sore. Sore may appear, shortness of breath, asthma, decay of tooth enamel. So when this is repeatedly experienced, when a person suffers repeated GERD, then what happens? The tooth enamel may decay because of the acidity. Okay, and trouble in swallowing. So I feel something is obstructing my neck. So this sort of experience you may get. So this is there will be, or you may feel I feel there is something in the neck, maybe a lump. So this sort of feeling you may experience. Chest pain, Sometimes when this happens, chest pain may appear. So sometimes we confuse it. In fact, it may be due to angina. This angina pain and pain because of GERD are almost like that. So whenever it is a pain, so immediately some ECG should be performed to rule out whether it is cardiac origin or not. Okay, so these are the symptoms, and sometimes you may feel this point, acid brush of hypersalivation. So when there is the content enters into the esophagus and there is increased salivation. So when this acid combines with salivary juice, it creates a taste. That taste is called acid brush or acid brush. And sometimes you may feel taste like bile. Acidity, then notice the acidic is sour taste, no? And but taste of bile is different. So you may feel the taste of bile also. Complications. What are the complications? Dysphagia. What is dysphagia? Swallowing difficulty. And odynophagia means painful swallowing. So that may be, and bleeding. Why bleeding? Because acidity may create ulceration, or not ulceration, damage to our esophagus. Inner lining is our esophagus is made up of squamous epithelium. And why squamous epithelium? Because squamous epithelium can withstand pressure. It is not easy to tear it. It's like skin. It's like skin inside the inner lumen of an inner surface of the esophagus is like skin. Okay, but when repeated entry of acidic content appears in the esophagus, this may cause tearing or sore. So from this sore, blood may come out. Choking throat is another complication. Chest pain is another complication. So these are the complications of GERD. And the key factors, one I said, it is the lower esophageal sphincter pressure. Malfunctioning means it is not tightly closed. When it should remain tightly closed, that time it is not tightly closed. So it remains open. So while stomach contracts, so it comes out. So this is one here. Another is decreased clearance of contents of esophagus into stomach. Again, decreased emptying of stomach into the intestine. So when there is delayed emptying of stomach, contents of the stomach, so this may come out into the esophagus. So this is another reason that causes GERD. And reflux acidic contents. When this acidic contents is very less than, pH is less than 4. So this may create, since this acid is so less than 4 means it's more acidic. So this will create this. And another important factor is hiatal hernia. Hiatal hernia, what is hiatal hernia? Part of stomach, so there is diaphragm, no? And there is a hole. So esophagus enters, then only stomach is formed. Now what happens in the hiatus hernia? Part of stomach comes above the diaphragm, and the sphincter lies over it. See the picture. This sphincter should have been here. Since part of the stomach has gone up, and form a herniation. This is called hiatal hernia. So this is another important factor of GERD. It is another important factor of gastritis, another important factor of peptic ulcer. These are the foods and medications that may worsen GERD symptoms. What are these? Fatty meal, carminatives, chocolates, coffee, cola, tea, garlic, onion, chili powder, alcohol, spicy foods. This will create irritation of the esophagus. Spicy food, orange juice, tomato juice, coffee, tobacco. So that they will aggravate GERD symptoms. And these are the medications that may cause GERD. Okay. Complications of GERD. So, if repeated GERD is there, so what complications may arise? So, this is esophagitis, inflammation of the esophagus. Next is erosion and ulceration. So, third point is Barrett esophagus. What is Barrett esophagus? Normally, as I said, the inner lining of the esophagus is made up of squamous epithelium. So this may be replaced by columnar epithelium. When these are replaced by columnar epithelium, then we call it Barrett epithelium, Barrett esophagus. And there may be stricture. So it is the lumen. So in between there is an obstruction created by growth of some cells or some tissues. So this is called stricture. Narrowing of the lumen, narrowing of the esophagus. So there may be stricture. Secondary to fibrous tissue deposition. After why it happens? Secondary to fibrous tissue deposition after long-standing erosion. Okay. And another, the worst condition may develop from this. What is this? Cancer. Esophageal cancer. Now see, what is this? Cancer. What is this? Stricture. So, cancer of esophagus. Repeated GIT, prolonged suffering from GERD, this may lead to esophageal cancer. And see, what is this? This is the inner lining normal esophagus. See, this is the inner lining made up of squamous epithelium. This is the inner lining. So see the lining. Whereas in Barrett's esophagus, see it is replaced by columnar epithelium. So it may happen. So there is another complication, ulceration of esophagus. These are the ulcerations. Okay, see the endoscopic picture. So this see cuboidal epithelium, not cuboidal, columnar epithelium. These are the reflections. So by endoscopy you can identify, you can diagnose. Okay, and reflux esophagitis because of reflux of contents of stomach. And these are the ulcerations, stricture. What is esophagitis? Esophagitis is inflammation of the esophagus. It may cause dysphagia. It may cause audiophagia, we already told, and retrosternal chest pain. Okay, and it can be diagnosed by upper GI endoscopy, or the treatment approach for this nowadays. What is the medicine you get? It's common. Over the counter, these medicines are available. Pantocid, Pan 40. So these are what? These are proton pump inhibitor. These are proton pump inhibitor. Over the counter, we also get famotidine, ranitidine. These are hydrogen blockers. So while you will be treating peptic ulcer or this sort of GERD, so you will be prescribing. So there are mainly three different, nowadays only, most commonly what is used? First choice is proton pump inhibitor. Okay. The second choice is hydrogen blocker, hydrogen inhibitor. So most importantly, to prevent GERD, what we have to do? We have to modify our lifestyle. Most important. So whenever you go to a doctor, they will give medicine, and at the same time they will say you modify your lifestyle, because it is not it. You are not properly sleeping, you are not properly eating, you are not doing exercise, so your lifestyle is not at all good. So that aggravates, that initiates your GIT, peptic ulcer, these sort of things. So better you have to, first thing you have to change your lifestyle. So if the patient is obese, we will ask for weight reduction. Okay. When the patient is suffering, so while sleeping, the head should be raised. Head should be raised so that food cannot enter from stomach into the esophagus. So how much? At least 6 to 8 inches. Okay. Then smaller and frequent meals. Frequent meals, not 3 meals, smaller meal in between. Say if somebody is suffering, so you keep some biscuits in your bag, in your pouch, so from there you take some biscuits in between. Okay. Protein-rich meals you should have. Protein-rich meals you should have. It increases LES pressure. LES means lower esophageal sphincter. So when it is constricted, it increases the pressure. When it dilates, the pressure is reduced here. So when pressure is reduced, food will be coming out. So it increases the content, this protein content of the food will actually cause constriction of the sphincter. Avoid food and medications that exacerbate GERD, like painkillers. Okay, and avoid alcohol, tobacco. There should be cessation of tobacco. And as I said, these are the actually antacids, Gelusil, like that. These are the antacids available, and these are there in this suspensions. There is aluminum hydroxide, magnesium hydroxide. So these are actually to neutralize the excess acids, already secreted acids, they are neutralized by this. So nowadays some sachets are also available in the market, So, and hydrogen receptor antagonists, proton pump inhibitors, and lastly these are very costly and not so effective. So first three are most effective one. And not needed. Okay, we are then coming into, these are the treatment. Now you are not undergoing, you will be learning later. Vomiting. So you have experienced vomiting. What is vomiting? It's like GERD. It's like GERD, but in that case it is coming automatically, GERD, but you are doing it forcefully. Forceful expulsion of contents of the stomach or intestine into the mouth. So there is a difference. This is also regurgitation, expulsion of contents of the stomach and intestine, but it is forcefully. And how this force is generated will come into this, and expulsion of these into the mouth. So this is vomiting. So vomiting or emesis. It is also called emesis. So we will use the term emesis. Vomiting or emesis is the forceful expulsion of the food from the stomach and intestine through the mouth. So this is the definition of vomiting. And complications of vomiting, what it may cause? It may cause, sorry, there is a spelling mistake. It may cause vomiting, dehydration, repeated. So during vomiting, lot of salivation is there. Some fluid you have taken through food, that will be vomited. So in your body, there will be less intake of fluid. So you may suffer dehydration. So this fluid also contains some electrolytes, important electrolytes. So there will be electrolytes. See, these electrolytes also coming out through salivary juice and through the food you have ingested, the fluid you have ingested. So there will be loss of electrolytes. So electrolyte imbalance may happen. Dehydration as well as electrolyte imbalance. Okay. And aspiration. Aspiration means while vomiting, vomitus may enter into your respiratory tract. It may enter into a respiratory tract. So this is another complication. Aspiration means entering of food vomitus into respiratory tract. And recurrent vomiting may cause esophagitis. That's already, we know that. And recurrent vomiting may cause loss of enamel of teeth. We have already seen. And recurrent vomiting may cause fresh bleeding from the small tears, erosion in the GI, in the esophageal inner wall, inner lining of the esophagus. What causes vomiting? What are the etiologic factors of vomiting? So these are the infection, gastroenteritis, and stomach irritation by food poisoning or food poisoning, certain nauseating smell. Sometimes some people, when finds an accident case or sees blood, immediately starts vomiting. So it is because of emotions. So out of emotions, we also, particularly the ladies, so the females, they affected by the emotions in ladies. Stress also causes pregnancy, motion sickness. You have experienced it. Some people while traveling, they vomit. Okay, so the motion sickness, those who are having vertigo, because of imbalance in the semicircular canal, fluid is there, we have vestibular apparatus. So these vestibular apparatus, there are 3 semicircular canals. They are actually maintain our balance. So when you are running around a field, so your body is inclined, but you are not dropping, you are not falling down. Because of what? Because of this semicircular canal. So semicircular canal and cerebellum. So karate students, they are learned when you are in danger, you hit here. Here lies the cerebellum. Immediately your opponent will be losing control of balance. He will fall down. So vestibular apparatus through cerebellum controls the body posture, equilibrium is maintained. And migraine. I think, how many students are having migraine? Very serious. Headache. When you suffer this one-sided headache, there is lot of problems. You feel nauseated, you feel vomiting, you don't like irritation, don't like heat. So there are a lot of problems. So this may also cause vomiting. Certain medicines like anesthesia, when anesthesia is given, so vomiting may start. And some diseases like brain tumor, brain injury, and concussion, sudden injury to the brain, temporary injury to the brain. This is called concussion. So temporary injury. So this temporary injury is concussion. So this may cause vomiting. Sequence of events. How it starts. Initially you will be nauseated, and this nausea will cause increased salivary secretion. Then what will happen? Your breathing will be increased. It will be fast and your breathing will be deep. Okay, deep breathing will be there and vomiting sound, retching. So there will be retching, vomiting sound will be there, and your glottis will be closed so that the vomitus doesn't enter into the respiratory tract. So then pyloric part of the stomach is contracted and there is antiperistalsis. Normally peristalsis from to aboral region, from mouth end to the anus end. So now there will be reverse. So contents will try to come out. So again there will be pyloric part of the stomach contracts firmly and antiperistalsis may take place. Descent of diaphragm. You do one thing. Now what happens? Your abdominal muscles are constricted and diaphragm, whether it will be going up or coming down. Now inhale. Going up? No. Coming down. This is the diaphragm. And these are the diaphragm muscles of the diaphragm. When phrenic nerve stimulates this muscle, diaphragmatic muscles, so this muscle will be contracted. As a result, there will be lowering of diaphragm. Purpose to increase the thoracic diameter of this thoracic cavity. Expansion of the lung, creating negative pressure within the lung, so that the pressure within the lung becomes less than the atmosphere. Now, because of the atmospheric pressure, air will enter within the lung. So, during inhalation, what happens? There is lowering of the diaphragm. Now, you see, now there will be inhalation, there will be lowering of this. Okay, now what is the role of muscle, intercostal muscles? Intercostal muscle means in between the ribs, the muscles are there. Whether they will be contracting or they will be relaxing. There are two types of muscles in the intercostal. The intercostal muscle, one is external, another is internal. External intercostal muscle when contracts, you think a bucket. What? And this bucket is having two handles. One is this side, another is this side. And these handles are ribs. Now you see, now the ribs are at resting condition. What is the distance? This is the handle of the bucket. This is the handle of the bucket. Now what is the distance between the handles? This much. Now if you lift the handles by contraction of the external intercostal muscle, what will be? Diameter will be increased. Lateral diameter will be increased. So increase in lateral diameter means increase in diameter of the thorax. Lowering of the diaphragm means increasing vertical diameter. So because of this movement, there will be total increase in the thoracic volume of the thoracic volume will be increased. So volume is increased. Inside there is a balloon, means lung. So there will be negative pressure within this balloon. Okay, but because we know pressure depends on volume. If volume is more, pressure will be reduced. If you reduce the volume, pressure will be increased. So you have expanded the thorax, means there will be reduction in pressure. So now air will inhale. Can you now you can tell me, thorax is expanded whether because of entry of air or because of contraction of the muscles. Contraction, see the process. Contraction of the muscle expanded the thoracic case, and there is no direct contact between lung and thoracic case. In between there is a space, interpleural space. The interpleural space will become negative. When it is expanded, the interpleural space becomes negative. So now what is, since lung is elastic tissue, this will also, since there is a negative pressure, so there will be expansion of the lung. So it will create negative pressure within the lung. So now this is open, nasal cavity airway is open, so air will rush in. This is inhalation, inspiration. Anyway, so what happens at 7th stage? Descent of diaphragm, contraction of the abdominal wall, rise in intra-abdominal pressure. So if intra-abdominal pressure is increased, stomach will be pushed upward. When stomach I have contracted abdominal space, reduce the abdominal pressure. So where this abdominal content will go? It will create pressure upward. Means it will be creating pressure on the stomach. So their content of the stomach will create further pressure. Since volume of the stomach will be further decreased, as a result pressure will be increased within the stomach, so the contents will be coming out as vomiters. The lower esophageal sphincter. Now what will happen? The LES, lower esophageal sphincter, will open. Pressure is increased, it will further open, further release, so now the content will be entering to the esophagus. Now esophagus will also contract. There will be antiperistalsis. So the contents will come into the mouth. Okay. So how this, actually it is a neurally controlled. So we have a vomiting center in medulla. Some input is coming to the medulla, this center. So say, suddenly you saw or you could smell a very, very bad smell or very bad odor. Bad smell. So what is it? So that has stimulated your center. Now the center activated and it will produce the vomiting, it will create vomiting reflex. So let us see the path. Higher centers. There are some higher centers like hypothalamus, cerebellum, levering, area, postema. When we think about this, when we are in stress, when we smell some bad thing, so or we see something, some sight which also create vomiting. যেটা দেখতে ভালো লাগছে না. This sort of sight may create vomiting. So where this will create stimulation of the higher centers. Now the higher center will stimulate vomiting center. Now the vomiting center will cause closure of the soft palate so that vomiter doesn't come out of the nostril. So this will close the soft palate, closure of, there will be glottis, so that the contents are not entered within the respiratory tract. So there will be, respiration will be stopped, lower esophageal sphincter will be relaxed, and somatomotor signal from here will cause abdominal pressure raised. So all these things will cause increase in pressure within the stomach, so contents will be coming out. So these are the, say, some irritation, say, some afferent impulse. One impulse is coming from the center, higher centers, Another impulse may coming from the stomach itself. So from stomach, because of the irritation of the inner wall of the stomach, the signal will come to here as well as to here. It is the spinal cord. From here spinal cord, it will be related to this, and some fiber which are parasympathetic efferent, not efferent. They will also carry impulse from here directly to the middle, and there it will stimulate inhibitory center. Now the diarrhea. Everybody suffered diarrhea. What is this? What is diarrhea? What is diarrhea? Diarrhea is frequent and profuse discharge of what? Intestinal contents in loose and fluid form. And we know that. So this is diarrhea. Okay? It may be, why it occurs? Because of rapid movement of the intestine. Because of rapid movement of intestine. When there is rapid peristalsis, rapid movement of intestine, there is less scope of absorption of the food, less scope of digestion, less time, no? It is passing rapidly the food. Okay, so there is less time of digestion, less time of absorption, particularly of fluid. So what is the result? What is the form? What will be the form of the stool? It will be soft. It will be liquid, mostly liquid. So liquid is not absorbed. Electrolytes are not absorbed. What will be the consequence? Dehydration. There will be dehydration. So this is the one maybe important complication is dehydration. In diarrhea, the fluid is not absorbed sufficiently, resulting in watery bowel discharge. Acute diarrhea may be caused by temporary problems like infection of the GI tract. Okay, gastritis or esophageal inflammation of the intestine, and chronic diarrhea may be due to disorders of the intestinal mucosa. There are different disorders in intestinal mucosa. What are these? Swollen and irritated GIT, ulcerative colitis, irritated bowel syndrome, irritable bowel IBS, in short we call it IBS, Crohn's disease. Crohn's disease means swollen and irritated GIT, lactose intolerance. Are there any one of you having lactose intolerance? No, good. They cannot digest lactose because of absence of the enzyme lactase. So these are not digested, and that will create diarrhea. Some persons after digestion of carbohydrate, we produce monosaccharides. Now suppose you have taken a lot of sugars. So this sugar will be having fructose and glucose. Glucose will be absorbed readily, but there is difficulty in absorption of fructose. So it will be in some patients, they will not be able to absorb this fructose. What will happen then? This may create diarrhea. Unabsorbed fructose may create diarrhea. There is a protein in wheat called gluten. Sometimes in the market we look for gluten-free wheat. They advertise our wheat is gluten-free. So this gluten may cause celiac disease. So there will be, in celiac disease, there will be diarrhea. Why? Because there will be loss of intestinal mucosa. So function of intestinal mucosa is absorbed. So it will be unable to absorb food materials. So this will be as watery secretion. This will be going out of the GI tract. The common causes of diarrhea is contaminated water, contaminated food, and artificial sweeteners that are added in the food, and spicy food, fatty food, etc. Moreover, food intolerance due to lactose or poor fructose absorption or gluten of wheat. So this may also cause diarrhea. Infection. This is actually most common reason. What are the? It may be bacterial infection, it may be viral infection, it may be amoeba. So what are these? E. coli, Salmonella, Shigella, these are the bacteria that cause diarrhea, and viruses, rotavirus and hepatitis virus, etc. They can cause diarrhea. Parasites like Entamoeba histolytica, Giardia, they can cause. Reactions to medicines like antibiotics, antihypertensive drugs, antacids containing particularly magnesium. I said these are made up of magnesium and aluminum. So where more magnesium is there, so that may create this problem. We take it for what? As antacid. So taking excess antacid may cause diarrhea. Intestinal disease like inflammation of the intestine, ulcerative colitis, celiac disease, spelling mistake is there, and IBS, abnormal motility of the intestine, may cause diarrhea. Features of diarrhea, how do you know there is diarrhea? What will be there? Water and electrolyte loss leading to dehydration, electrolyte imbalance. Chronic diarrhea results in hypokalemia, electrolyte imbalance, metabolic acidosis, and other features are abdominal pain, nausea and bloating. What is bloating? A condition in which patient feels the abdomen is full and tight due to excess intestinal gas. Okay. So, and symptoms of acute diarrhea, loose and watery stool, bloating and cramps. You feel that, and urgent need to poop, means defecate, and nausea. Okay. Symptoms of severe diarrhea, fever, headache, severe abdominal pain, vomiting, blood or mucus stool. Symptoms of dehydrations, you will see the symptoms of dehydration, dry skin, irritability. Mentally, you will be very much irritable at that time, dizziness, fatigue, and dark urine, means the concentrated urine. Water is lost, no? So there is no sufficient water to excrete. Now, constipation. What is constipation? There will be, that earlier one was, there is rapid movement of the GI tract. Here we will get, there is less movement of the, not the whole GI tract, the colon. Particularly colon, there will be less movement. So there, because of less movement, there will be stagnation of the stools, stagnation of the food. So because of stagnation, there will be the time, enough time is there, so our intestine, large intestine, it will absorb water from it. As a result, what will be there? The stool will be solid. And now this solid, number one, there is no movement. Secondly, food is very much solid. The stool is very much solid, so it will be very difficult to evacuate. So this is constipation. Okay, so number one, there is lack of movement. Second, maximum absorption of water, and because of absorption of water, the stool will be very solid. Inability to completely evacuate the bowels or passing very hard stool is known as constipation. This is constipation, we know that. And lastly, Adynamic Ileus. When operation surgery is done, so there is lack of movement of the GI tract. So as a result, what happens? The GI tract sollens and there will be flatulence because of lack of movement, and this condition actually prevails for 6 to 8 hours because of surgery or irritation in the abdomen that may cause this thing. What is this? Adynamic ileus. Means there is no movement in the GI tract. There is no, mainly after the surgery.